The University of Tennessee Medical Center is our region's only academic medical center. Our mission is to serve through healing, education, and discovery. Our goal is to share the knowledge of our physicians and staff in these health education videos as you make healthcare decisions for yourself and your family.
Every year, anyone above the age of 6 months should receive a flu shot. The number one most common viral syndrome that is experienced every year is influenza virus. Number two, very important for every adult to receive a pneumonia shot that is 65 years or older. And any patient that has a chronic disease or a smoker should take this up with their physician, but it is recommended if you do have any chronic lung disease to receive a pneumonia shot before the age of 65. In addition to those shots, you definitely would need to consider a shingles vaccination. The shingles virus is essentially the same virus that causes varicella or chickenpox as children. The CDC recommends that everyone above the age of 60 receive the shingles vaccine. However, the FDA has approved it above the age of 50. Next is definitely everyone needs to consider a Tdap shot. The tetanus component of the Tdap is recommended every 10 years. However, the pertussis component of that shot is showing in the aging population to be waning in immunity. So at a one-time shot of Tdap is recommended anywhere above the age of 21, one time until 65 years of age, which they recommend getting another Tdap shot. Next is HPV, human papillomavirus. It is a virus that causes cervical cancer in women. It is the number one most common sexually transmitted disease in America. 50% of the population in America that is sexually active are carriers of this virus, however, do not always display signs or symptoms. HPV is now recommended for boys and girls at the age of 11 to 12 years, and it is a series of 3 shots. At the age of 21, boys are not recommended to start that vaccine later than 21 years of age. However, women can get this shot up to 26 years of age. Also, it is recommended that everyone be tested against or tested for their immunity against rubella, which is essentially a combination of measles, mumps, and rubella in a vaccine. Measles and mumps it's considered that any adult that is born before the age of before the years of 1957, they are considered to be immune against measles and mumps. However, rubella is only able to determine if someone is immune against rubella with serologic testing, which is a blood test. Some common misconceptions with vaccines would include the association or link with autism. This has been extensively studied and proven to be not the case. Autism, unfortunately, is on the rise, but we do believe that autism is on the rise because we are getting better at diagnosing autism. There is no association with autism and vaccination. Another misconception with vaccines and immunization would be patients who believe they have received a flu shot in the past and contracted the flu virus from the shot. This is indeed false. The vaccine itself is an inactivated, dead virus, and it's actually indeed just particles of that virus. So there's no possibility that you can receive a vaccine of flu and actually have the disease process. However, there are some viral syndromes that mimic the flu virus, and that's very common that folks do indeed have those viruses and not the flu. In addition, the flu vaccine is commonly given too late into the flu season. The flu season usually starts early in the fall, sometimes as early as late August and early September. Most people tend to wait until the winter to get their flu shot, at which point they can be exposed to the flu virus prior to their body's immune system building the ability to prevent the flu virus after getting the shot. So once you get the flu shot, you have about a 2 weeks time frame for your immune system to build the antibodies toward that flu virus. Yes, indeed, there are some contraindications to vaccination. In particular, patients that are immunosuppressed or have a weak immune system should be counseled by their physician on which vaccines to consider. In particular, vaccines that are live viruses would be a contraindication to an immunosuppressed patient. Examples of these live viruses would be measles, mumps, rubella, or the varicella virus. The patient who is immunocompromised is typically either an HIV/AIDS patient or a patient undergoing chemotherapy or a patient with a history of a splenectomy or a removal of the spleen. So each patient with any kind of chronic disease definitely needs to discuss their recommendations with their physician on which immunizations to consider.
We hope you'll join us soon for another medical moment. Visit utmedicalcenter.org or call the Healthcare Coordination Office at 865-305-6970 to learn about services available at the University of Tennessee Medical Center.